Patient is good, educated, understands your consultations, has agreed to take. Here, this drug really works. How does it work? It will not only bring down HbA1c more as compared to when you're using the basal insulin alone. You will require much lesser dose of insulin. See here in this study, the dosage of insulin required was almost half of what it is required. So there's a dual effect. First, you're requiring a lesser dose of insulin, so lesser weight gain. Secondly, the drug itself is acting to reduce the weight. Now this study had to happen because we are dealing now with two group of molecules which are acting in a way which we want, and that is SGLT2 inhibitors with GLP-1 receptor agonists. So in this they had used dapagliflozin and empagliflozin, and in addition to that they tested this molecule as compared to the placebo. And what they found, there was a greater reduction in HbA1c, and this happened with both the doses. There are two doses of Trulicity, 0.75 and 1.5 as compared to placebo. And there was much greater weight reduction. One thing which was concerning them was what will be the kind of side effects that we will deal with when we are combining these two. The GI side effects will be there, that was there. But what was interesting and what we were looking for didn't happen. There was no increased incidence of DKA or hypotensive episode or genital infection or fractures. Now, whatever be the situation that you use this drug, whatever be the combination that you are using with it, it will always cause some amount of weight loss on itself. It decreases weight loss, is comparable to liraglutide, and when you compare it with that, when you are giving it with the insulin, the group which will receive the insulin will have a weight loss, whereas if you are giving just the insulin, the patient might be actually gaining the weight. And the thing which company talks about, I would put it in the last, their USP is the ease of use of the patient. You have to give it only once weekly, can be administered any time of day, and it has got actually nothing to do with the meals. You don't have to reconstitute, the patient does not have to put the needle. Needle is already there, and he has to just press the pen and wait for the click sound, and the drug is delivered. They actually did a very interesting study, the patient preference study, in which they hid one information which I'll tell you. What they did, they first looked at the group of patients who were willing to inject first of all, and they had already been on metformin and another drug had to be added, and they were given a choice to choose between two hypothetical injections which were actually representing Trulicity and liraglutide. It was told to them that one of them you will have to use once weekly, the other once daily. The blood sugar HbA1c change is more or less same. If you use the once which is given daily, you will have more weight loss, and the delivery system is different. Here there is a single use pre-filled pen, there you will get a multi-dose pre-filled pen. The frequency of nausea will be more with this, and you will virtually have no hypoglycemia. Then they were shown the videos of how to take this injection, and then questionnaire was assessed to assess what will they choose. And they realized that prior to this information around